Good afternoon. I'm Mandy Cohen. I'm the Secretary of the Department of Health and Human Services for North Carolina. And this afternoon, I'm joined by Director Mike Sperberry and Brian Tipton and Nicole Fox are our American Sign Language interpreters. And working behind the scenes as our Spanish language interpreters are Jackie and Jasmine Matevier. As always, I'll start with a rundown of our numbers. For North Carolina, as of this morning, there were 9,142 laboratory confirmed cases in 95 counties. We have 473 people who are currently hospitalized, and sadly, there have been 306 deaths. We report these data regularly on our COVID-19 dashboard. That's at ncdhhs.gov/COVID-19. Excuse me. Throughout our response to the pandemic, we have sought to expand the information we share. Today, we launched two new additions. First, in order to standardize reporting, we are posting a new report on our COVID-19 outbreaks in congregate living settings. The report will include names of facilities where there is an outbreak, that's 2 or more cases, as well as a number of positive cases at that facility. The report will be updated twice per week. As this pandemic evolves, we will continue to assess the appropriateness of data reporting to balance transparency, public health, and individual privacy. Second, we now have North Carolina's COVID-19 key metrics to stay ahead of the curve available on our dashboard. As Governor Cooper shared last week, we are looking to make progress on testing, tracing, and trends to guide the state's plan to slowly lift restrictions. There's a new key metrics tab on the dashboard for the combination of the metrics we're following. As a reminder, there are 4 of them. The first is COVID-like syndromic cases. Second, lab-confirmed cases. Third, positive tests as a percentage of total tests, and hospitalizations. The dashboard will also share where we are on our testing and tracing capacity, including our supply of personal protective equipment, number of tests per day, and staffing for contact tracing. We also have some progress to share on that front today. I'm pleased to announce the formation of the Carolina Community Tracing Collaborative, a new partnership with Community Care of North Carolina and the North Carolina Area Health Education Centers to expand contact tracing. Our local health departments are North Carolina's expert in this essential detective work. North Carolina has a significant advantage over many other states doing this work because we have that strong public health infrastructure. The new collaborative will hire and train local staff that will support local health departments' contact tracing efforts. This will allow us to meet the goal we shared last week to double the number of contact tracers we have in the state to 500. Contact tracing is the process of supporting patients and notifying contacts of exposure in order to stop the chain of transmission of the virus. This also helps North Carolina understand the spread of disease and more rapidly identify people who may have had COVID. Recruitment for contact tracers will start immediately, today. Anyone interested in applying may visit the Community Care of North Carolina website. Special consideration will be given to those who are unemployed, have community engagement experience, and live in the communities that they will serve. Before I wrap up, I also want to share new information shared by the CDC this weekend. The CDC has expanded the list of symptoms that may be associated with COVID-19. We've been talking for a long time about fever and cough and shortness of breath, but the CDC also added some additional symptoms for you to be aware of. They include chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. These symptoms may appear 2 to 14 days after exposure to the virus. Very important for everyone to know it's not just cough and fever anymore. We want folks to be looking for chills, muscle pain, headache, sore throat, or a new loss of taste or smell. As always, please practice social distancing and wash your hands to prevent the spread of the virus. Thank you for staying home to save lives. And with that, I will turn it over to Director Sprayberry for his update.
Thank you, Madam Secretary. This is Dave